talk a little bit now about procedure day. So the day of your AFib ablation, you'll park in the visitor parking deck at HCA Mercy Hospital and register at the first floor at your set arrival time. You should bring your insurance cards and your identification cards. After you register, you'll wait for the nurses from Prep and Recovery to call your name and take you back. The nurses will ask you a few questions about your medical history, if they haven't already done so at pre-admission testing, and they'll get you ready for the procedure, including starting an IV. You will have your labs drawn if you haven't already had that done at pre-admission testing. And then also, if you have not already met with the anesthesiologist at pre-admission testing, you'll meet with them before the procedure. Remember to discuss any previous anesthetic problems you or a family member have experienced. For most AFib ablations, you'll have what's called a transesophageal echocardiogram, or a TEE, done in the prep and recovery area. This is a procedure where an imaging probe is stuck down your throat to visualize your heart to ensure that you don't have any clots in your heart before the ablation is performed. You should let your EP doctor and the staff in the lab know if you have any swallowing issues or if you've ever had your esophagus stretched or dilated. If a clot is found in your heart, the ablation will be canceled for your safety. Sometimes, instead of a TEE, you'll have another form of imaging performed in the EP lab called an intracardiac echo, or ICE, to check for clots in your heart. After the TEE, you'll wait until an EP lab is available and then be brought to the EP lab to begin the ablation itself. In the EP lab, you'll be given IV sedation and an anesthetic and a medicine to help you relax. The skin on the groin area is numbed and a needle will be inserted into a large vein on both sides of your groin. And then what are called catheters, which are kind of like thin wires, will be threaded into your heart. And each of the catheters has a different function. Sometimes dye is injected to the heart to see heart structures. The physician will use a mapping system, typically, to determine where in your heart the abnormal rhythm is coming from. And when he finds the area, he's going to use a special catheter to send an electrical current to the area to ablate or cauterize the tissue. Once all the areas of the heart have been ablated that are causing the AFib, the catheters will be removed and the groin incision sites will be closed with sutures. If the doctor is able to induce other arrhythmias while he's in there ablating your AFib, then he may try to ablate these other arrhythmias during the procedure as well. After the procedure, you'll be taken to the prep and recovery area where your vital signs will be monitored and your insertion site will be monitored for bleeding. You'll have to lay still for several hours during this time just to ensure that you don't have any bleeding from the catheter insertion site. When your vital signs and insertion site are stable, you will likely begin the discharge process. The sutures in your groin will be removed, and a nurse will discuss discharge medications and other discharge instructions with you and make you a follow-up appointment to be seen in the clinic at about the 10 to 12 week mark.